For this portion of the project, we're going to review the medical treatment as well as the nursing diagnoses as they relate to croup. When a child presents with croup, what we want to do is treat the underlying illness if that is indicated. So if the child does have a bacterial infection that is causing the croup, we do want to treat that bacterial infection with antibiotics. Most croup cases are virally induced, so we would just go ahead and treat the symptoms of the croup. So when we do that, we want to encourage fluid intake. We also want to take the child outside, especially into the cool, humid night air, because that will help to relieve the mucosal swelling. And we want to try to keep the child calm, as when the child cries, it aggravates the airway obstruction and causes additional swelling to occur. Most cases of croup can be treated in the home environment. However, there are some instances in which the child would need to be taken to the emergency department. That would be if the child were to develop stridor while at rest, if you were to see cyanosis, if the child were to become extremely agitated or extremely fatigued, if the child develops retractions, or if they are unable to take oral fluids, as these are all signs of a worsening respiratory distress. When a child is seen by a healthcare provider, there are several medical treatments that they may try. The first of those I'm going to review is oral corticosteroids. Primarily, oral dexamethasone is used in infants and children. It is available. They are given in a single dose to help decrease the airway inflammation. Dosage range is 0.15 to 0.6 milligrams per kilogram of body weight. It is available as a liquid or a pill, and the pill may be crushed and mixed in a small amount of food such as applesauce or syrup to make it is bitter, so it'll help it go down a little bit easier. Doing this can greatly reduce the number of croup-related hospitalizations. The next step in treatment to reduce the laryngeal edema and bronchospasm would be to administer racemic epinephrine. This is administered via nebulizer with oxygen. When this is given, it requires close monitoring due to the short duration of action. When it wears off, rebound stridor can occur. The child should be monitored in the hospital for at least 3 hours following the treatment, and the child should not be discharged home if stridor or retractions do recur. Here is an example of a nebulizer machine with a facial mask, which is ideal for infants and younger children. And here is an example of another type of nebulizer machine, and this one, the piece goes actually directly into the mouth and is ideal for older children. If symptoms become severe, hospitalization will be necessary, where they can do additional treatment such as add humidified oxygen and IV fluids. The more severe symptoms we're looking at is progressively worsening stridor, retractions, cyanosis, and a decreased oxygen saturation despite treatment. If the child were to develop moderate to severe hypoxia, the child could be intubated. This would typically be done for 3 to 5 days, and the child would be cared for in the ICU. Extubation is performed only when the child can breathe around the tube and the inflammation has subsided. There are many nursing diagnoses that can be applied to treating a child with croup. I will just read through the ones that I came up with. I have risk for suffocation related to the inflammation of the larynx, activity intolerance related to generalized weakness, dyspnea, fatigue, and poor oxygenation, deficient fluid volume, which is related to insensible losses such as fever, increased respirations can also increase the fluid loss, and or the inadequate intake. Impaired nutrition would be less than body requirements, and that is related to anorexia, fatigue, weakness, a poor sucking and breathing coordination, and dyspnea. I also have an ineffective breathing pattern related to inflammation of the tracheo-laryngo-bronchial passages, impaired gas exchange related to insufficient oxygenation as a result of the inflammation or edema of the larynx, ineffective airway clearance related to excess tracheobronchial secretions if those are present, and risk for aspiration related to a poor inability to coordinate the breathing, coughing, sucking, and swallowing. And that would be related to edema of the larynx causing a narrowed airway. And finally, I have hyperthermia related to the infectious process, the fever, anxiety and fear related to difficulty breathing. This is present in the child, but can also be present in the parents as they become anxious with their child not breathing well. And finally, deficient caregiver knowledge of the disease process and the care techniques. If the parents have never dealt with this condition before, or if they are talking to other family and friends that have dealt with this condition but are giving them inaccurate information, this is a great opportunity to do some teaching to the parents. Thank you very much for watching this little video, and I hope it was helpful.